Nurse Cliff Resurrection is preparing for battle against the insidious, invisible enemy he and his colleagues have been fighting for months. COVID-19 is now sending so many people to the hospital in California. There are no more intensive care unit beds open here at Harbor UCLA Medical Centre. So they've moved coronavirus patients into the emergency room. Some are so sick, they're hooked up to no less than 8 IVs, pumping in vital medicines to save or soothe them.
Very exhausting, It's really like a never-ending struggle. It's really tough right now.
Everyone here has been exposed to the trauma of loss over and over again. But the patients just keep coming. What's it like right now for your staff?
It's a disaster right now for our staff. The patients are extremely sick. This is a horrible disease. I hope I won't cry because it's been 10 months of this, and we are inundated.
They can't send patients out to other hospitals in Los Angeles County because in the most populated county in America, there is not a single licensed ICU bed open. All 2,500 are full. At last count, all of Southern California had 0 ICU capacity. 0.
And there's no break. There's absolutely no break. And even during July, it wasn't so bad. But this time, we're seeing large numbers.
Nancy Blake says this is so much worse than the first 2 surges of the virus because now they're getting their normal amount of emergency patients plus a large number of coronavirus cases. In the past 2 weeks, California has seen a 63% increase in hospitalizations, and in just one day, around 40,000 new infections were reported. This as 98% of the state is under a stay-at-home order. That is clearly not what is happening. What effect does that have on your staff?
They're angry because at the very beginning, it was people were saying nurses are heroes and great job, and now they're not listening to us. They're not wearing their masks. They're saying it's a hoax. And I have to say, I'm a glass half full kind of person. My glass is empty right now.
But amidst the signs of suffering, there were signs of hope. Healthcare workers lining up to get their first dose of the vaccine, each sending a message as to why they're getting inoculated. The first day it arrived, the mood soared, but soured by the afternoon as more patients crushed into the emergency room.